Have you heard of Ozempic Face as one of the most talked about side effects of this wildly popular weight loss drug? You've probably seen the headlines, dramatic before and after photos, celebrities opening up, and users expressing concern over their rapidly changing appearance. But what exactly is Ozempic Face? Is it dangerous? Is it permanent? And most importantly, can you fix it? In this video, we're diving deep into what's really going on behind the scenes and what you can do if you're affected. Ozempic, also known by its generic name, semaglutide, was originally developed to manage type 2 diabetes, but lately it's been making headlines for something else: rapid and significant weight loss. Sounds amazing, right? Well, yes, but not without consequences. One unexpected result that users have reported is something now widely called Ozempic Face. Doctors and dermatologists are seeing it more often, especially in people over 35 who lose weight quickly while on the drug. So, what exactly is it? Ozempic Face refers to a sudden loss of facial fat that leads to a gaunt, hollowed-out appearance. The cheeks appear sunken. The skin can look looser, older, even saggy. You might look like you've aged 5 to 10 years in just a few months. This happens because when you lose weight quickly, especially with medications like Ozempic or Wegovy, your body sheds fat from all over, including your face. Not everyone will experience Ozempic Face, but it's more common than you might think. You're most at risk if you're over the age of 35. You lose more than 10% of your body weight quickly. You had less facial fat to begin with. You have naturally thinner or aging skin. The face is one of the first places people notice weight loss, and unfortunately, it is also where it can be most unforgiving. Here is the good news. Ozempic Face isn't dangerous, it's cosmetic, but that doesn't mean it doesn't affect people deeply. Your face is part of your identity. When it suddenly changes, it can take a toll on your self-confidence, your mental health, and how others perceive you. Many users say things like, "I love my new body, but I don't recognize my face," or "I feel older than I did before I lost the weight." So, no, it is not medically dangerous, but it is real. And for many, it's emotionally significant. Here's the big question. Can you prevent Ozempic Face while still losing weight? The answer is not entirely, but you can minimize it. Here are some tips. 1. Lose weight gradually. Talk to your doctor about titrating your dosage more slowly. The more gradual the loss, the less shock to your facial fat. 2. Hydration and diet. Stay hydrated and focus on collagen, supporting nutrients like vitamin C, zinc, and protein. 3. Strength training. Resistance training can help maintain muscle mass in your body and reduce the deflated look that sometimes comes with weight loss. 4. Skincare support. Retinoids, peptides, and moisturizers with hyaluronic acid can help maintain skin elasticity. 5. Medical monitoring. Always work with a healthcare provider. Ozempic is a beauty product. It is a serious medication. Already seeing signs of Ozempic Face? Don't panic. There are ways to address it, some non-invasive, others more intensive. Option 1. Dermal fillers. Hyaluronic acid-based fillers like Juvederm or Restylane can restore volume in the cheeks, temples, and under eyes. Option 2. Sculptra. This is a biostimulator, not a filler, that encourages your body to rebuild its own collagen. The results are slower, but more natural looking and long-lasting. Option 3. Skin tightening treatments. Non-surgical. Procedures like Ultherapy, Morpheus. 8. Or RF microneedling can tighten sagging skin and improve texture. Option 4. Fat transfer. In some cases, plastic surgeons can take fat from another part of your body and inject it back into your face. This option is more invasive but can offer longer-lasting results. Option 5. Let it stabilize. Sometimes simply waiting and allowing your body to adjust to its new weight will help. Skin often tightens naturally over several months, especially if you're still young. At the end of the day, Ozempic Face is a side effect of progress, a sign that your body is changing that can be both exciting and scary. If you're dealing with it, know that you're not alone. Thousands of people across the country are navigating the same journey. And the good news is you have options. Whether you choose lifestyle adjustments, cosmetic procedures, or simply time and self-love, there is a path forward. Your health journey is your own. Be kind to yourself along the way. If you found this video helpful, hit the like button, subscribe for more health insights, and share this with someone who's on the Ozempic journey too. Thanks for watching, and take care of yourself.